We've all been there. You get a cold, things are rough for a few days, but then you gradually start to get better. Except for that cough. It just seems to keep going. You feel pretty good, you head back to work, you're in a meeting, but then you cough a few times and everyone stares at you, and you quickly say allergies, thinking on your feet, but inside you're thinking, am I okay? Should I be getting this looked at? And this is where we meet our listener question this week.
Hi, Dr. Alland. I am curious about a cough that's been lingering for over 3 weeks. It's not disruptive in my life at all. I have no other symptoms. I just have this cough. At first, I thought it was just allergies, but now I'm wondering how long is too long to have a cough?
Welcome back to Hey Doc, Quick Question. I'm Dr. Jeremy Alland, sports medicine physician, team physician for the pros, and I'm here to help you get trustworthy answers to your everyday health questions. Today we're tackling how long is too long to have a cough. It's something most of us experience, but I think you'll be surprised at what is actually considered normal. It is one of the most common Hey Doc, Quick Questions I get outside of this podcast. Why won't my cough go away? We'll clear it all up right after this break. Let's briefly orient ourselves to cough. While we all hate coughing and we'll try just about anything to make it go away, it does actually serve a purpose. A cough is your body's natural way of clearing the airways of irritants, mucus, or infections. Without a cough, we would be at a much higher risk of pneumonia or chronic inflammation in our airways, which would eventually lead us to being unable to exchange air effectively. That would not be good. But do you know how long the average cough lasts when you have a cold? You may be surprised, but it's 16 to 18 days. And for kids, it can be even longer, up to 25 days. And those are just averages, so some could even last longer. No wonder so many of us are saying, why won't my cough go away? But when should we see a doctor for a cough that won't resolve? When it comes to duration, doctors classify coughs based on the American College of Chest Physicians guidelines. These guidelines say that an acute cough is less than 3 weeks. A subacute cough is 3 to 8 weeks, and a chronic cough is more than 8 weeks. This classification is important because it defines for us that in adults, a cough lasting more than 8 weeks is considered abnormal. It's at this point conditions beyond a cold become more likely, and a structured evaluation with a physician is highly recommended. But of note, in children, the threshold is actually shorter. Coughs lasting more than 4 weeks should be assessed. Some serious conditions are more common in kids, and early detection really matters here, so we want to see them sooner. So there it is. We have our answer. If you have a cough that won't go away, it is considered abnormal in adults when it's more than 8 weeks, and in kids when it's more than 4 weeks. But are there times when we should be seen sooner than those marks? Yes. And we call these red flag symptoms. These are things that can be associated with more severe illnesses, and we'd want to rule out bad things sooner than those marks. These include coughing up blood, shortness of breath or wheezing, unexplained weight loss, night sweats, fevers, especially fevers that are not associated with those first 3 to 5 days in which you're having an upper respiratory infection. Please don't wait on these. You see a physician, you either find something and get early treatment, or you get reassurance. This again is one of the most common questions I'm asked because, frankly, we're just not very patient people. What has been 5 days can feel like a month, and this has actually been studied. When asked how long to expect coughs to last, people said 5 to 7 days. But the truth is the average is over 17 days. This mismatch in expectations will drive us to seek out more treatments and likely end up with more medications like antibiotics and inhalers than we actually need. So remember, without red flag symptoms, a cough is considered abnormal length when it is over 8 weeks in adults and 4 weeks in kids. I want to thank our listener for this awesome question. Keep them coming. Your question could be the topic of the next episode. Go to heydocquickquestion.com to submit a question. If you found this helpful, please subscribe, and then please share it with one friend. These episodes fit perfectly into the last 10 minutes of your commute and can save you from that urgent care visit for a cough that is eventually going to go away. And as always, I really appreciate being a part of your weekly podcast routine. I certainly know that I have my routine, and it's an honor to be a part of yours. Stay healthy. I'll see you next time on Hey Doc, Quick Question. Hey, you made it to the end. Great. Now the legal stuff. This podcast is for educational purposes only. It's not medical advice, and listening doesn't make me your doctor. I mean, I like you, but we don't have that kind of relationship. So please, don't use this podcast to diagnose yourself or to treat other people. Always talk to your actual doctor or healthcare provider when it comes to your health. Neither I, Dr. Jeremy Alland, any guests, nor Hey Doc Quick Question LLC can be held liable for anything you do or don't do based on what you heard here. In short, this is information, not a prescription. Be smart, stay curious, and talk to your doc. Oh, and hey, send me your questions.